The government on Thursday reported the highest daily death toll in the history of COVID here in Thailand, 7 within the 24-hour period, with 1,470 new reported cases amongst the community. Top of the unpopular charts was Bangkok, with 446 cases in the capital alone. There it's on the rise after Tuesday's 350 and Wednesday's 365. In other regions, 118 in Chonburi, 99 in Chiang Mai and 97 in Chonburi, with 42 in Songkhla. 477 patients were discharged yesterday after full recovery, but over 18,000 people remain in hospital care. The Ministry of Public Health is optimistically betting on a 3-week time frame for numbers to slow down, and they're backing the Create drug, a herbal remedy, as an aid to patient recovery, along with the globally used favipiravir, of which 2 million more batches are on order for the country. A study in Samut Prakan Hospital found that all patients who received 180 milligrams of Create daily saw an improvement in their conditions by the 3rd day with no side effects. Russia has accepted a request to provide Thailand with the Sputnik V coronavirus vaccine. An odd wording, but that's the translation, and it doesn't mean it's a done deal. But negotiations are certainly underway as the Prime Minister is committed to finding 35 million more doses of approved vaccinations over and above the 65 million which are either currently on order or inbound to the nation. Koh Kood, just off the Trat coastline and neighbouring to Koh Chang, is the first of Thailand's islands to close to tourists until at least May. 2 local cases saw the authorities making the decision in order that island residents are protected. The biggest single issue for all, clusters aside, is domestic tourism, which has seen thousands travel around the country, perhaps to escape the numbers in the capital, but without doubt helping the virus spread. Currently there are no bans on interprovincial travel. However, many provinces have smartly introduced their own forms of quarantine for visitors. In Chiang Mai, a Buddhist meditation centre is listed as the region's current highest source of the virus, which has taken a serious grip there. Hospitals are crammed with 2,500 patients, and all indications are that the numbers there will, as in most areas, continue to rise. In Lampang, medics reported 9 cases of side effects from the Sinovac inoculation. With 604 vaccines already given out, that's 1.5% of the total. Patients who did have side effects showed signs within 15 minutes of getting their shot, and included swelling and pain in the injection areas, which is common, but also dizziness and exhaustion, which disappeared within 24 hours. Bearing in mind the fact that the majority of those shots were given to medical professionals, it's accepted that they themselves see nothing untoward with Sinovac. In Isan, Nakhon Ratchasima's province has had 76 COVID cases over the past 5 days, most attributed to either spread amongst families or those who visited Bangkok and were the first to show the signs. Good news for those planning at some time international travel, as the Department of Land Transport launches new international licences from May the 1st, that will also see travellers within those listed under the Vienna Convention allowed to drive in other countries for up to 3 years instead of the current 1. For those with Thai licences here, the new international version will be available to Thais and non-Thais for 505 baht, and you don't need an agent to get it. You simply need to present 2 passport photographs, your Thai licence, your passport itself, and either your residence permit or work permit. Meanwhile at home, and as the Chonburi Public Health Office added further timelines and venues to the regularly updated list of places visited by COVID sufferers, it was clarified that yesterday's figures showed Banglamung, that's Pattaya and the area surrounding, as having the highest number of new cases, 46. Chonburi city itself had only 18 and Sriracha 8. On the island of Koh Chang, 4 cases were found, which may see that island closed too. The latest locations listed, which will have all had COVID controls but unwittingly hosted customers who had the virus, are the Diamond Badminton Court on 3rd Road on April the 6th, 9th, 10th and 16th from 6 until 8 in the evening. Atoll Cafe on Soi Buakhao from April the 6th to April the 18th, all those days, from 5 until 7 in the evening. The Sandbar by the sea at Dongtan Beach on April the 7th from 7 in the evening until 10. Sky Mountain at Bali High Pier from April the 9th through to the 16th from 7 in the evening until midnight on every day, and Hustlers Sports Lounge and Diner on 3rd Road on April the 11th, 14th and 16th from 5 until 8 in the evening, and on the 17th from 1 in the afternoon until 3. The good news is, as always, that the chances of you becoming even seriously ill are remote. For most, the symptoms will be flu type, but at the same time, all those with COVID are carriers and can quickly pass the virus without knowing it. Avoiding as many people as possible, keeping away from crowded areas including markets, and constantly using alcohol gel to keep yourself clean, along with avoiding touching your face with your hands and generally taking care of yourself and family, will enhance the chance of you not catching it, and at the same time protect others around you. And with the reminder, mitts, masks and meters, wash your hands, wear a mask and keep social distancing. And the Met Office promising highs today of 33, dropping down to 28. A hot, sticky day with the chance of storms. Local and national news today from Fabulous 103 FM and Fabulous Pattaya Media Group. And to get a notification every time we release another bulletin or programme, like and subscribe to our channel, Fabulous Pattaya Media Group, by using the link below.